Meet Dr. Anna Freire. She is a naturopathic doctor practicing in Brampton, Ontario. But before she became a naturopathic doctor, she attended conventional medical school and became a medical doctor. In this video, she discusses why she made this career change and shares her unique experience of working in both the conventional medical system and naturopathic medical system, and how she hopes in the future the two systems can work together to help patients. Thank you so much, Anne, for giving your time and agreeing to be interviewed. The first question I'd like to ask is, what led you to conventional medicine and to become a conventional medical doctor?
Okay, well, first of all, happy to be able to be here with you. So you're very welcome. I appreciate you even asking me to do this. Now to answer that question, what led me to conventional medicine? I think, as cliche as it sounds, it was kind of like a calling, because I don't really recall ever wanting to do or be anything else as a kid. Mm-hmm. I always found like the human body like really fascinating, and then even as I got older, like just the disease process, like why people get sick and how do you kind of like treat that. So that was always fascinating, and because like during school, you know, I did well in biology and chemistry, so it's like, okay, this is aligned, so that could definitely be the path. And because at the time when I was considering medicine, you know, conventional medicine was the medicine. There was no other medicine to really consider in lieu of more of that conventional career path. So that's kind of how it happened.
Okay. All right. And I know that you studied medicine in Portugal. Why did you choose medical school in Portugal?
Well, because I'm Portuguese.
Okay.
So that kind of
makes sense.
Yeah, that came from that. Like I was born in Portugal, but my parents moved to Canada when I was, you know, maybe 6, I think, because I went into first grade here. So it was probably that 6-7 years of age, and you know, they had always, and myself as well, had always wanted to move back, but we wanted it to be as less disruptive as possible. So it's kind of like, okay, when do you transition? When do you do that move? And you know, from university to high school was kind of the time that made sense, or would be less disruptive. And because Portugal also has what they call like a concurrent medical program, like much like the UK, for example, or other areas in Europe, you enter directly into medical school. So that's attractive. So based on whatever your grades are in high school, and then you have to write a set of like specific exams, you get admitted directly into medical school. And then during medical school, you kind of earn like your bachelor's in health sciences, but it's already like the medical program. And then you earn your MD at the end. And because it's a 6-year process in Europe, they also make it into like this integrated master in medicine. So at the end you write a thesis. So it's like a big conglomerate. You kind of just go through the motions, earn those degrees, but you also come out of it with your medical degree. So, you know, it's the moving back, going back to Portugal, the concurrent program, which was really attractive, and not that I'm biased, but you know, the training and the caliber of physicians in Portugal is pretty amazing. So that was another, you know, plus to it all, that I was going to be trained in a country that also, you know, trains great professionals and has a great program. So it all kind of came together. So that's why Portugal, rather than having stayed here or going to somewhere else.
Okay, well, that's really nice, actually.
Yeah. It you know, it takes some time, because I know some people think, you know, oh, that's so young to be making a decision of, okay, what do you want to do? And when you have that undergrad, that gives you a little bit of time to explore a thing. But for people like myself, that you're like, no, this is it. Yeah. The fact that you can kind of just go into the program is so liberating. Like, you know, you're working toward that, and there's not going to be like 3 or 4 years after where then you're going to have to go another hurdle. You kind of do it while you're maybe young and naive, and you're kind of like, what? And then once you're in the program, like, okay, you're kind of set on that path.
Yeah, that would be lovely here in Canada, actually.
That would be nice, I think, you know, something to consider.
There are 3 new med schools being built.
Yeah, it's one in Brampton, right? if I'm not mistaken.
I'm not entirely sure, but
that might be it. Don't quote us on it.
But my next question now is, what led you to naturopathic medical school?
So I think that was part of the existential crisis I was having after medical school. And at this time, I know, at this time I was actually back in Canada.
Okay.
As much as I love Portugal, at that time in my life I had finished the program, and I was also thinking, oh, I really miss Canada. I guess because I never thought that would happen. Not that I don't like Canada. Obviously I'm here. I love Canada, but I also loved Portugal so much, and it's a completely different lifestyle that I thought like, yeah, I'd be set. But there was just something there that I was just like, I miss Canada. I had a lot of like my formative years here, so there was like obviously that big pull. And as obviously you've seen from like a lot of the career change, I kind of go with what I'm really feeling kind of called to do. And I thought, if I don't go back now and kind of just see what this feeling is all about, I may never have the chance, right? Because then you start having other commitments, and you kind of just set down like roots, and then to make that huge change again would be really disruptive. So I'm like, okay, I'm going to do it now. So I was here already in Canada, and just kind of going through the rigmarole of getting licensed here, and I was doing my observership, and I would just go home at the end of the day, and I'm like, this can't possibly be the day-to-day of like primary care, just the enormous gaps in care, and just the feeling of like failing these patients day after day, of like, I have to be able to provide more. I need to do more. Like, what if we're missing something? We're not giving them the attention. And so I started to brainstorm of like, okay, well, medicine is all I wanted to do. It's all I want to continue to do. But how can I use my medical degree maybe in a different way? Like, how can I add something on to be able to provide a different type of care? And somehow, kind of CCNM fell into my lap. I'm not quite sure how I found out about the Canadian College of Naturopathic Medicine. I think it was in one of those like going down the rabbit holes of like trying to figure out what are the other options here. And they had a bridge program for people with a medical degree. So I'm like, okay, this is it. And because the way that my family and myself kind of live and already had that relationship to health, like the philosophy of naturopathic medicine was very much ingrained in me. It wasn't anything that I'm like, oh, this is new. It's kind of how I already lived my life personally. And naturopathic medicine then kind of allowed me to kind of bridge bringing the care that I wanted to patients in alignment with my own like philosophy of what I kind of wanted to be able to provide to others. So that's kind of how that detour happened.
Okay. Wow.
Yeah.
2 follow-up questions
Yes.
to that, because you mentioned gaps. So what do you think for you was the gap in care that you wanted to provide but you just couldn't?
I think it's coming from a place of like, when conventionally, at least in the primary care setting, right, like someone comes in, they have like this one complaint or symptom that is never isolated. There's always like a backstory and a history of like what led to it and how it's affecting your life in that moment that you never really get to explore. It's like, I have a cough, okay, and the conversation really ends there. Obviously, there's other follow-up questions, but it's primarily that. You're not like, okay, well, how does it affect you? How long have you had it? Like, what's happening? Like, is your family disturbed that you're always coughing? Like, you really don't get to understand the patient from that perspective. And so it then becomes like you're just trying to sublimate or band-aid whatever that complaint is, but without ever really looking at how that experience is affecting that person or their family dynamic or their work life, what have you. And so that's the biggest gap of not being able to really follow through on that person's whole journey. It's kind of just increments of like moments in time where you're just talking about like one symptom or another symptom, but you're never really putting it all together, like seeing that whole picture of that patient, of what they're feeling and what they're experiencing because of it.
Okay, and That's a decent gap. But,
Yeah.
The second question is, what part of naturopathic medicine philosophy were you most attracted to?
I think it's that holistic approach. Really, in conventionally we talk about it, like the mind-body connection, or the biosocial perspective to health. But then in reality, we don't always assess that or really take that into consideration. It becomes a conversation very much just like, okay, what's your physical complaint? With naturopathic medicine, approaching that individual as a person and not just as an illness or a complaint, and looking at the totality of their health status and how that one particular symptom or disease fits into the whole picture is really attractive. And it's probably one of the reasons why I love traditional Chinese medicine so much, is because like emotions are part of the disease picture. It's integrated into what you assess. It becomes such a complete picture of that person, and it's in those details, I think, that you really make the big changes and help patients make those big changes, because you're not just looking at them for one specific thing, negating everything else. It's really an overhaul.
Yeah, we really do.
Yeah.
Like, oh yeah, you have back pain? Well, tell me everything. Tell me about your work. Tell me about your stress. Tell me about this. Tell me about
Exactly.
that. It's not like, okay, you have pain. Is it really bad? Okay, here's this, and hopefully it gets better. See you later.
Exactly, right? It kind of it's limited, and not that that's wrong. It's just that's the way it's set up.
That is what this person needs, and maybe doesn't want to dive too deep into
Correct.
that. But then there's other people who would benefit from that kind of attention and care.
Agreed. Yeah. Kind of meeting people where they are, and I very much agree with what you said. Right, like it is also about like maybe what they need in that moment, and symptom management is definitely important. But then it's, if we're really looking to do some of that healing, then yeah, we do have to address all the other things you've mentioned to really get to the bottom of it.
Yes. So it sounds like naturopathic medicine was a very attractive option for you. What did your family and friends and maybe coworkers think about your career change?
Well, I can't say for sure, because we never know what they're thinking, and sometimes I think people just want to be polite, or they don't want to offend you, even if they're thinking you're like, oh, I don't know. Of the colleagues that I speak to, that I have more of like an intimate relationship with, they were fascinated. They're like, oh my gosh, like what's the change? How is it? Kind of curious about what the practice really is, and kind of like the therapies and things that we offer. So that's been fun, but also because I have that friendship with them. I think just colleagues that are just simply professional colleagues are probably a bit like, okay. In terms of my family, like my parents, they weren't disapproving, but they were definitely worried or concerned, because they're like, are you sure you want to do more training? Like, I already sacrificed and gave so many years to this one thing, and now having to like restart, in essence, not necessarily, obviously you're taking your training with you, but like restart a new path, incur more financial hardships, right, as like part of that training. And then even once you're kind of done with that, then it's like that business, setting up a business, kind of like it's a different venture all to itself. So they were like, well, we're going to support you, but probably in a trepidatious way of like, it's a big transition. I'm no spring chicken. So, right, it's, you do want to eventually kind of settle down into your career and kind of build that stability with that transition. It's kind of shook things up a bit, but so who knows really what people might be thinking, but at least from the feedback, some concern about, just because it's such a big change. But overall, no negative feedback specifically, at least not to my face, maybe behind closed doors.
That's like for anything, I suppose. Like,
any life choice.
That shirt definitely looks good on you.
It's like
But yes, it's good to have, I guess, some people who are just naturally like worried and they just want the best for you,
Exactly.
and then so they're always going to have some worry and like,
Mm-hmm.
are you sure? But it's good that your parents are supportive.
Yeah, that's been a huge help. Yeah, especially through kind of that training period where you kind of go back into being like a student, and then even afterward in terms of like getting into clinic. So yeah, without them, that would have been like much harder to bear some of like the ups and downs.
Yes. And so you've kind of seen both sides of, well, not sides, I don't want to say sides, but two different professions, I suppose, the naturopathic profession and the conventional medical doctor profession. I want to know where do you think naturopathic doctors fit into the current healthcare system in Canada?
Well, I think we really thrive in terms of when it comes to preventative care. So even getting to patients and individuals before they're dealing with like a health crisis, because we have so many tools and so much like education and empowerment that we can, and even just like health literacy that we can like impart, so people are able to make the best choices for them, so they're not maybe unknowingly doing things that might harm their health in 5 or 10 years. And then even when dealing with like chronic health conditions, like again, we have so many options and strategies, be them like dietary, lifestyle counseling, or other like supplementation that can be a great source of help initially and foundationally when dealing with chronic health conditions. And then also in the realm of patients that are going through other aspects of like other therapies that could really benefit from naturopathic medicine as a complementary care to help mitigate side effects, to help improve their healing times, or just supporting them through whatever journey they're on now. So I think we could really be integrated anywhere, both like first line in terms of preventative, but then also as a great support in dealing with some of the things that come up through various health journeys. So it would be great to see us be more integrated in the future.
I would agree. Yeah, I could definitely see, frontline, the preventative aspect, right, and all through supporting a patient through, like, if it does progress and get worse, like whatever condition they have, it's good to have I see our role as a health coach or a health guidance person.
Yeah, like an advocate almost, like
advocate and educator, right? Because they hear a lot of things from their medical doctors and they're confused about what their medical doctor just told them, and then I find myself, I'm always like helping them understand what their medical doctor just said. So
exactly.
Yeah, the literacy, the health literacy is very important.
I think. And because that also makes for like an informed person, a person that can actually give informed consent on a lot of things, and also have agency over their body. And if they do need to seek the care of another healthcare professional, or they've been referred to another specialty, it's so disempowering when like you have someone ask you like, well, have you ever had this or this, and people will sometimes like, oh, I don't know, no one's ever told me, and it's about their own health, and they haven't been given that information or explained that knowledge, and then you're kind of left as an island unto yourself within the realm of maybe being shuffled through different specialties, and so if you can understand your own health and have the ability to proactively also advocate for yourself is huge. So if naturopathic doctors can also be there to help from that perspective, I think that would probably be beneficial.
Yeah, I agree. Maybe I'm biased.
I know we are a little biased, but like considering like we see that a lot, like you said, with a lot of your patients. It's like that comes up all the time.
Yeah.
So it's something that you start to see like, okay, well, this needs to be amended.
Yeah, and we're allies to
Mm-hmm.
whoever is helping our patient get better. So
Exactly.
Question about what do you think medical doctors get wrong about naturopathic doctors? Because there unfortunately seems to be a bit of a naturopathic doctor versus medical doctor kind of thing out there. Yes. Well, what are your thoughts on that, and what do you think medical doctors are assuming incorrectly about naturopathic doctors, if they are at all?
Okay, so usually I think that medical doctors are assuming that naturopaths or naturopathic doctors are just kind of practicing on the fringe, that it's like this Wild West, that there's no rules, no regulations, that it's all folklore and like quackery, when in fact there's we're regulated healthcare professionals.
Tightly regulated.
Yes, tightly regulated healthcare professionals. So there's that, but also in terms of like the recommendations and the strategies we're using, they're having a huge amount of like backing by an ever-growing body of like literature and research that is compelling, and that is supporting the recommendations that are being made. So we're not just pulling things out of the air or doing things just because it's evidence informed, but then we're also being able to use that like traditional wisdom for more of like that holistic synergistic approach, which is part of that gap that we're filling. So I think that's probably the assumption that I see more, is that there's no research, or that things are just being done at will, and no one's really regulating us or making sure that we're doing the best we can in a more standardized way for patients.
I get a hint of that as well. And on the flip side, there are some assumptions we naturopathic doctors kind of have about medical doctors, and I know I have some assumptions, definitely, but since you have been a part of both systems, like, can you see where naturopathic doctors are often kind of assuming things about medical doctors?
Yeah, and you sometimes see it a lot online, like the rhetoric, or even patients that come in, they're like, I want nothing to do with the medical doctor, right? I think there is this kind of narrative that medical doctors, they don't really care about patients. It's like you're just another number, and you're just kind of circling through, and that you're sold out to big pharma, and right, it's just like this big conspiracy of like they don't want you well. They kind of just want you on like this treadmill. And I can't vouch for the whole profession, because we do know there are some things that happen that are, and we hear it from our patients, or we see it in the news, that sometimes things happen that it would lead you to maybe think that. But I think for the most part, or at least from the colleagues I've had and the medical doctors I interact with, they are really trying to do their best within a system that is also set up in a particular way that sometimes also really kind of handcuffs them to a particular way of practicing, or to particular recommendations that like they have to abide by. And so sometimes I don't think it's coming from a place of ill intent. It's just they too are on kind of that hamster wheel of having to turn those cogs, and so sometimes when you're looking out, or if you're out looking in, I should say, that it can appear that way, or can appear a little dicey at times, but I think, or I would at least like to think that it's not always like that, but there's probably work that needs to be done on both sides. There's kind of positives and maybe drawbacks in both professions. But as a whole, I'm hoping that we're all looking out for the best for those patients that we're privileged to see.
Mm-hmm. Yeah, so naturopathic medicine has its weaknesses and like pros and cons. The conventional medical system has pros and cons. How, in your opinion, do you think naturopathic doctors and medical doctors might be able to work together in some way? Like, what do you think that looks like?
Yeah, I think maybe kind of alluding to what we kind of discussed earlier, it's like more of like that integrated healthcare where similarly like different specialties have their own kind of areas of focus, and like your medical doctor might refer you to like your cardiologist or rheumatologist or what have you. We could integrate naturopathic medicine into that in terms of if you have patients that have a chronic health condition that need that additional counseling and support or aren't responding as well to certain therapies, that we integrate naturopathic medicine into that perspective. Or even if we take a step back, if we do that even before patients are dealing with a chronic health condition, and again, use naturopathic medicine as kind of like that foundational approach of like, okay, once you exhaust that foundational capacity that naturopathic medicine can offer, then it's kind of like that staircase. Okay, then you move on to more of that conventional realm while still being supported through naturopathic medicine. I think that would kind of be like the dream of integration.
Mm-hmm.
You know, I'm not sure how or when that might happen, but hopefully with like advocating, like the profession advocates for that, the population has the chance to advocate for that as well, because if they want it, usually changes happen to accommodate that. But there has to be a little bit more of that pressure to bring us on in terms of more of that integration.
Mm-hmm. Have you seen that integration in your practice before? Like, in your practice, do you collaborate with any medical doctors in your community?
Not so much. Not in terms of like a true collaboration. Like I do have a lot of patients where I work with their medical doctor, or they work with me, vice versa, to get an outcome for a patient, and we do that harmoniously.
Do it harmoniously with the motorbike in the background?
Yeah.
Yes.
So we try to do that, like, harmoniously and respecting both what each of us is trying to do or recommend. However, it's still not the easiest of relationships, I find. Not quite sure why, either because maybe going back to some of those assumptions that we've talked about beforehand, or even some patients that are just like, I don't even want to tell my family physician or whomever is underseeing their care that I'm seeking naturopathic care, because they're not for it, they don't care about it, they tell me they have no knowledge about it, so they can't even comment on it. So then that kind of breaks down that conversation as well. So yeah, to answer that question, not too much collaboration. I wish there was more. I think for the patient's sake, that would be the best if everyone was on board trying to care for this one person rather than kind of just promote their own agendas. But yeah, that's kind of been the reality, at least for now.
Mm-hmm. And when you were mentioning you would want like naturopathic doctors to take care of that foundational health for the viewers. I think I know what you mean, but for the viewers, what do you mean exactly by that? Build that foundational thing of health as naturopathic doctors, yes, and then go up like that staircase. What is it called? So like just not the staircase of health, but like the
like a stepwise approach, or like
I'm not recalling right now, but tell the viewers about what you mean by the foundation of health.
Yeah, so when I think about the foundational health, I think about all the things that are important from a very basic standpoint across the board to our health. So those are the things like discussing adequate diet to support your body and not to hinder, adequate like lifestyle strategies, things of like how much rest we're having, our sleep quality, if we're being physically active. The other is kind of that stress management component. Like a lot of us, I think all of us have stress, so maybe a natural byproduct of like the society we live in, and so those are the things that across the board, no matter what health goal we're trying to achieve or what chronic health condition we might be trying to manage, those things are always going to be part of the conversation, right? And so if we don't discuss them either before or during, then even if we are giving people supplements or medications, we've still left all of the things that contributed to their ill health at play. And so when I mean kind of like preventative or foundational elements of care, it's all of that. Making sure that we're not just looking for that one pill or that one supplement to take care of whatever it is we might be dealing with, but that we're actually building in all of the habits that are going to either help you recover faster, to manage whatever you're dealing with, or to prevent poor health outcomes altogether.
Agree. Yes, like there's no, well, in my opinion, no point in like me giving a supplement when like there is a point, but it's if someone is eating very poorly and wanting to achieve good health outcome and is expecting only a supplement to help them, they're just going to cancel each other out. Like the supplement will do some good, but then the lack of foundational health things that you were mentioning will just cancel the benefit out, and kind of don't see progression if you don't have that foundation. So yes, in your practice, I want to know what kind of patients do you see generally?
So even though like we have like a general practice here, the cases that I end up seeing most often are both like gut and mental health. That's also like the areas that I enjoy working with most, so maybe that's why like you kind of start cultivating a patient population that deals with a lot of those things. So that might be things like what we traditionally think of as IBS, SIBO, like other just overall like indigestion, like bloating or diarrhea, constipation, reflux, like GERD is really big. And then from that mental health sphere, a lot of cases of like anxiety, depression, burnout, or overall just like heightened stress due to factors that might be going on at the moment for patients. I do see now also a bigger, I should say, population of what we might have traditionally called like women's health concerns, so like things like PCOS, endometriosis, other menstrual health issues, and also people that are like trying to conceive also seek naturopathic care often, again as that complementary care there. So I think those three would be like the big groupings of cases that I see most often.
Okay. And in your practice, you've been practicing how long now?
Since 2018, so it's going to be 5 years.
Yes, okay. In your 5 years of practice, seeing those specific cases, what is like the most difficult part of being a naturopathic doctor? Just in general, I guess. Not just for those cases, I suppose.
So in general, the most difficult thing I found being a naturopathic doctor is the business aspect. Okay. Like the things that happen in the back end, it's been like a steep learning curve because you're providing a service and care but then everything else needs to be happening in the background for you to be able to provide the service and care, right? So that's probably the most difficult component I find. It's not the care that I'm providing, it's everything else that needs to be in line to make that happen. But strictly from like a practice standpoint, I think for me, it's the amount of energy I give to my patients, both when you're in the visit, because we do have longer visits, so there's like a big energetic exchange where you're kind of like holding space for that person and but also having to not just be present for what they're discussing with you, but also having the other side of your brain kind of strategize, okay, what would be then the most appropriate thing for this person, so you can give them feedback at the end of their visit. But then it's everything else that happens before and after. It's all of the research, all of the prep. It's all like the protocol that you're writing, and then after the visit, it's like the in-depth like treatment plan that you send them afterward, and so that can easily at times, if we're not careful, and I'm kind of speaking to myself when I'm saying this, and Sarah, is if we're not careful, right? If we're doing a lot of the hand holding and also taking personal ownership for what's happening in terms of their health journey, if those boundaries are blurred, that can easily lead to, a lot of depleted energy and even sometimes burnout, because you take on so much because you're so invested in that person, and that can be difficult because then the lines are always blurred. Even like on your day off, you're like doing research or going over lab work or protocols, or you're doing continuing education, or you're worried about like, oh, is that person doing better? Like, let's check in or follow up with them. So it's a consistent list of things that run, and that also depletes your energy personally. So that's probably in practice the most difficult thing, I think, personally for me. But I think I see Sarah nodding along, so it's like it's a common theme, at least between the both of us, that it's just like that significant amount of energy that we give to the person, the people that we're caring for, but also to the business that we're trying to run and create.
Yeah.
Mm-hmm.
That's all I can say.
Yes, it's like, yep.
Yes. For the viewers again, because I know what you mean by business side, could you be more specific about what you mean by the business side, the business aspect of it?
Yeah, well, because, as naturopaths, right, like, you become a business onto yourself, right? You're a naturopath, so then you are the face of that business, that service, and so we need to keep up with like regulations. We need to make sure that everything's like in accordance to what needs to be done from that regulatory perspective, both in terms of like forms and what we have in clinic or what we do, our own like continuing education and things of that nature that we need to keep up with, and all the things that go along with that, with like registration and things from that perspective. And then from the actual like brick and mortar, and now a little bit less of brick and mortar as we've kind of transitioned to like hybrid, where we do have telemedicine appointments than in person, but it's the actual like promotion of your services in a way, because we want people to be able to access naturopathic care and to know we exist and to know what we do. So like any other service, people need to know you exist for them to be able to make that decision if they want to access naturopathic care, if they want to see Sarah, or they want to see me or whomever, right? So it's all of that part, all like the marketing really, even though that sounds odd sometimes when we talk about it from a perspective of like healthcare, but it is, because we want people to come see us, we want them to get better, so we need to market our services. So that's like all maybe traditional marketing that people might do, like billboards or ads or things, but now it's a lot of like the social media aspect of marketing, because that's usually the most accessible and what most people are looking at. They're on their phone, they're either on Instagram or Facebook, or like searching on Google and finding like websites. So doing all of that as well, whilst you're trying to care for your patients, can sometimes be a bit of a juggling act.
Agreed.
Yeah.
Because yes, we want to help patients, but the first thing that we got to do is have a patient know that we exist, How do we let a patient know we exist? We have to do all this back, the behind the scenes work to make that happen.
Yes.
Like make a website, make social media posts, let people know around you, like, this is what I do.
Yep.
This is what naturopathic doctors do.
Yeah, that education part of it as
like,
well.
Yeah.
Demystifying.
Yeah, so many people think that we just inhale lavender oil, even though we have some lavender here. But like that's the only thing that we do.
Yes.
But there's much more. So that education to the public, to the general population of what we do, like there's that work behind the scenes. And then finally, someone who's interested in our services, then they come to see us, and then we hear their story and take care of them. But then, as you said, it's a lot of work after.
Yeah.
Just getting a person in the door to help them, and then when they're here, there's a lot of work to be done to improve their health. So
exactly. It's never ending.
It's never ending, but slowly but surely we're getting better, right?
Yes.
It's getting easier day by day.
It's like year by year.
or year by year.
It's like, okay, when you look back, you're like, okay, I've made some strides this year.
Yes.
But I think for me personally, at least day by day, it can be like, oh, nothing's changing. You're putting in all this effort.
Mm-hmm.
And you're like, it's funny because it's what we preach, or at least what I preach to my patients, like naturopathic medicine, it's a slow process. It takes time. But then from a business element, I always want things to like, needs to happen now. And so maybe if I have to also transpose like the same naturopathic philosophy onto business, like things take time, but if you're being consistent, you will see the fruits of your labor. But it is kind of like the long haul. You're like in it for the long haul. It's not like a quick process building a business and building like a name and a reputable name at that, especially with a lot of referrals from patients. I always tell my patients when they're like, oh, I've referred you to like my friend or my family, or somebody comes in, it's like, oh, I heard about you from like a patient of yours. Like I always tell them that's like the highest compliment, because like somebody is like vetting for you essentially, who has had a positive experience, who has felt so inclined to let others know that like you need this in your life. But like that word of mouth, I still think is like the biggest in a way form of like marketing, but it's also the one that trickles in slowest.
It's true, yes.
Because sometimes even if people were to kind of shout your name from the rooftops, right, not everyone is prepared or wanting to see a naturopath. So even if they know about you, doesn't necessarily mean that they're going to be like,
that they're ready.
Aha. And I think being ready to see a naturopath is
another component,
because we do get our patients to do a lot of work. Even though we're there to support them, like at the end of the day, they're the ones that have to go through it. And if you're not ready, then either the process is not going to be as comfortable, or you're not going to see maybe the results that we're hoping for you to see. So being ready is that kind of the other caveat, which I haven't really talked about, but kind of merits us discussing that, being ready and enthused to see a naturopath and to kind of do that is important as well.
For sure, yes. And that's the kind of patient you want to see. Is you don't want to be, pulling teeth saying, here, you want to get better, this is what you got to do. Oh, you don't want to do it? Well... Trying
to convince someone, right? Having to convince them of like what they're essentially in there for becomes counterproductive, right? Because if they're not on board that they need to make these changes, then there's no amount of information that you're going to be able to change their mind. They have to do it to see the benefit, and then they're going to want to do it themselves because, oh, I'm feeling so much better. But if you're trying already to convince them from the get-go, and they're not really buying into it, or they're really just refusing to make those changes, then it's okay. Then it's setting expectations at that time, right?
I'll see you when you're ready for this, right? But then, there's patients who are super gung-ho. They're just all about change. They're like, I want to make a drastic move on, like, improving my health. And I see that those are the patients that really benefit.
Yes.
They're like, okay, what do you want me to do? I will do it. They do it, and they see improvement.
Yeah.
So
Oh, that's so like
it's magical.
It is magical, and that just yeah, I just feel so happy
Mm-hmm.
when I see that, because like I said, alluding to all the work we put into it, right? So then if you have then a patient that's on board with all of the things that you've kind of discussed with them, and they see the improvement and changes, and you're seeing them do well, and you can also then move ahead with like maybe the next part of their treatment, and you're both kind of like
Mm-hmm.
in unison in that effort. It also takes a load off you, right? Because then you're not kind of racking your brain of like, okay, well, what else can we offer, or how else can we support you if those strategies aren't working, or you just don't want to do them, right? It then becomes like we're trying to really search and dig deep for things, because if the patient's not ready, then it's just kind of like we're both, I think, using a lot of energy and not really seeing any of the fruits of anyone's labor, right?
Yeah. Mm-hmm. Yes. So, and you're doing a lot. Okay, it sounds like you're doing a lot back end. You're doing a lot taking care of patients. You're in it for the long haul, it sounds like.
Yeah.
What do you enjoy most about treating patients like with this naturopathic approach? Because it sounds like you're really into it. What keeps you going?
I think probably like the transformative nature. I think that's the word I would use, right? It's that transformation. Because when you treat a patient, kind of again alluding to what we discussed earlier, from more of like that holistic, all-encompassing approach, where we're not kind of just giving them a supplement for their sore throat and one for their reflux and one for their anxiety, but we're really trying to piece it all together and give them the suggestions and the recommendations that's going to like overhaul their life on a deeper level, and not kind of just putting out mini fires. Then you'll see like this transformative aspect to their health. They are doing overall much better from all standpoints, rather than, oh yeah, I no longer have a cough, or like, yeah, my reflux is better. It's more like they feel better just overall. So it's that transformation, and the fact that they then become more empowered and more willing to continue making the best health choices for them, because they want to continue feeling that well. That's probably the thing that I like most about what we do, and also what I like most when I see in patients that have put in the effort and get to reap that transformative nature to naturopathic medicine.
Mm-hmm. Same.
Yeah.
I think you and I are on the same page.
We're like
on a lot of things.
Yes, I think that's
We're
why
the
this
same
interview
person.
came about, right? Because we resonate on a lot of those
Mhm.
things where we're like, yes.
Mm-hmm. Yes. So, couple more questions. If someone is interested in naturopathic medicine, and it's their first career choice, or it might be their second career choice, what advice do you have for that person who wants to become a naturopathic doctor? What would you tell them?
I think I would just tell them the same thing I would tell anyone else that kind of is making a career choice, either a transition or that first career. Really sit with it. Imagine how your life might be if you were doing that, or like practicing naturopathic medicine. If you have the opportunity to speak to naturopaths, to get an understanding of what it takes. That is sometimes nice, because sometimes we go into things blind, like imagining one thing, and then the reality might not be in line with what we think, and then we do all those career jumps, right? Because we're like, okay, this isn't for me. So really making sure that you're kind of aligned, and it's something that you really want to do because you love what you're doing, because there's going to be a lot of like difficult days, and if you're not really in it for the right reasons, it's going to make all of those trials and tribulations probably difficult to overcome, or you can easily kind of let yourself feel into those things if you're not kind of steadfast on why you wanted to do this in the first place. So yeah, my advice would probably just be get as much information on it as possible. Maybe speak with some people that are practicing and see kind of like the day-to-day, the realities, the things that are really great and the things that maybe are a bit harder, so that you can actually, again, make that decision knowing as much as you can before you commit to it, to all the training and for the expense, so you're able to make the best decision with the most information, so you're not kind of regretting it afterward.
Okay, solid advice.
Yep.
And tell the viewers, if you could, how they might be able to find you and work with you. What's the best way a viewer can get in contact with you if they want to know more information about what naturopathic medicine is like? Maybe a viewer wants to see you as a patient. How can they get in contact with you?
Probably the easiest and quickest way is probably through social media, even though sometimes we're like, ugh, social media, but it's the most accessible for the majority. So for me, it's either like on Facebook or Instagram. You'll get access to a lot of content, free content that I try to put out, part of that educational component that I'm kind of taxed myself with of like providing. And then there you can always send me a direct message to either ask any of those questions that you have about naturopathic medicine or about how to book in with me. I do work in person in Brampton at In Good Hands Wellness, so there's always the option to call the clinic to book a meet and greet or an initial visit. I also have another clinic that is strictly virtual. That's Grassroots Health, and with that clinic I do have an online booking link. So again, those are all on social media, so you can take that approach as well.
Okay, thank you so much, Anna, for your time and the information and your perspective, your very unique perspective.
Yes, thank you.
For the viewers, all her information, all her links to her Instagram, website will be put in the information section below of this video. So you can find her and get to know her more if you're interested. Thank you again.
Thank you.
Have a great practice.
Yay!
You look at that paperwork. Sorry. Shoot. I messed it up.